Hello everyone, I'm Joyce the Dentist. Today I'm going to talk to you about peg laterals and how to fix them. Peg laterals affect an estimated 2 to 5% of the population. But what is it? So laterals are what we call the smaller pair of teeth that are on the side of your two front teeth. The middle two are called central incisors, and then you go out one, and those are called lateral incisors. We have 4 incisors on top and 4 on bottom, but peg laterals usually only involve the ones on top. What am I even talking about, you ask? Sometimes the lateral incisors on our top teeth are really skinny and don't have that nice, wide, flat shape that make them look like a smaller version of the central incisors. Instead, they're narrow or conical, like a little peg of some sort. When they're like that, we call them peg laterals. Anytime your lateral incisors are narrow like that, it creates this sort of weird asymmetry to your smile, or even creates gaps in that part of your smile. For what we consider traditionally attractive teeth, we typically look for symmetrical shapes across the teeth. Even though there's nothing inherently wrong or unhealthy about having these skinny little peg laterals, it can make people feel self-conscious about the way their teeth look. By fixing the peg laterals, we can change the appearance of those teeth to give your smile better balance. As a result, your overall smile is more attractive, and all we've done is adjust 2 teeth. Again, keep in mind, we tend to look for symmetry in beauty. To achieve that symmetry, we have to address the overall shape of your entire peg lateral and don't necessarily need to involve the other teeth, which is great. Chances are, if you have one peg lateral, you probably have one on the other side of your smile. Our teeth typically tend to mirror each other, so more than likely, we're probably going to want to fix 2 peg laterals at the same time. When we treat the teeth together, we can use the same materials, same lab, same ceramist, and same shades for better matching purposes. Aesthetically, it's better to treat them together rather than one now and one later. Depending on how badly pegged the lateral is, we're probably going to talk about either doing a crown, veneer, or a little bonding. With a crown, we basically cover all 360 degrees of the tooth with a protective shell. We lightly prep the laterals and prepare that tooth like we would a normal crown or any other tooth. In this case, we're probably placing 2 crowns at the same time, one for each peg lateral, and matching them so that they both symmetrically complement each other and blend in with the teeth around. After your teeth are prepped, your dentist takes a scan or impression for the lab and then covers the prepped teeth with a temporary crown. Once the lab finishes designing your final crowns, you come back a couple weeks later to get them bonded into place. Your other option is cosmetic veneers. For veneers, we need to make sure there's enough tooth structure to bond the veneer in place. Veneers are a more minimally invasive option that often requires less tooth structure removal to get to the final result. They're one of my favorite ways to restore peg laterals. Veneers allow us to create a new size, length, contour, and color for the tooth, and then bond that restoration over the front of your healthy tooth. It's possible to place veneers on the laterals only, but many of the times, patients will come in wanting a full smile makeover and incorporating veneers onto all of the front teeth at the same time. Doing it this way can enhance your smile and create a lot more uniformity in the smile. The process of getting veneers is similar to getting a crown treatment in that the teeth are prepped slightly and there are impressions that are made or scans. The only difference is that they're less invasive to the tooth structure since we're not buffing away any of the enamel on the backs of the teeth. That's why if we have a choice between a crown or a veneer, I always choose a veneer because it's less invasive to the tooth structure. And last but not least, composite bonding is your final option. Bonding uses tooth-colored filling material to sort of build up or cover minor tooth discrepancies like little chips or gaps. If your peg laterals are mild, we might be able to bond over the sides of them to make the tooth look fuller. This option has to be decided on a case-by-case basis, similar to placing veneers on certain teeth. Structurally, certain conditions have to be met, so it's up to you and your dentist to decide which option is best. For people who are deciding between composite or a porcelain veneer, there are pros and cons to each. While porcelain veneers require very little tooth structure removal, especially compared to a full crown, a composite requires no tooth structure removal in many cases. Composite is usually a completely additive procedure, which is great, especially for patients who are extremely young. A lot of the times I'll do a composite style veneer on a younger patient, which requires, again, no tooth structure removal, so that they can make a more informed decision when they get to a certain age. The biggest drawbacks of a composite veneer for a peg lateral is that they can stain over time and discolor, and they can also chip much more easily than a porcelain veneer. As far as insurance coverage is so weird about this, but most peg laterals will qualify for crown treatment, which requires 360 degrees of tooth removal, but not necessarily veneers or bonding. So before you set your heart on one treatment, definitely talk with an experienced cosmetic dentist to decide which restoration will provide you with the best results. And if you like this video, hit the thumbs up and watch this video next.